Dr. Prakash,
Yes.
you are the role player. Huh?
Yes.
So narrate the scenario.
Yes. So you are supposed to talk with a medical student. So regarding the different insulin regimen,
Okay.
different types of insulin.
Okay.
Mm.
So what is the name of the student?
Eman.
Okay. So I'll start. Okay.
Mm.
Dr. Hiren, you keep the time, please. Hello.
Okay. Just a minute.
You are having food?
No. Done.
Okay. So
Just, let me set the timer. Wait.
good morning.
Good morning.
Hello, Ahmad. I'm Dr. Sandeep, one of the doctors working here. I guess you know me.
Yes. So I have seen many times in the
Okay.
ward rounds.
Okay, Ahmad. So how is your posting in pediatric going on?
So I'm indeed enjoying
Okay,
the
good to know
posting.
that. Yes, Ahmad. I came to know that you have some concerns and questions regarding insulin. Is it right?
Yes, sir. We were discussing in the morning round regarding this one about the patient, the diabetic patient, known case of the diabetic, regarding the insulin, but I didn't get, and just I'm interested, just I want to know the different types of regimen. So can you
Yeah,
detailed explain?
Ahmad, I really appreciate your keenness to learn new things. As this is an important topic, would you like to invite your colleagues to join our discussion?
No, right now all are busy in their place of
Okay.
posting. So we can go ahead, no
Okay,
problem.
not an issue. Let's discuss this together.
Oh,
So,
yeah.
can you tell me like what do you know about the insulin and the regimens? Do you have any idea?
Yes, I have a little bit idea,
Mm-hmm.
just but not in detail. Just I know this long acting,
Okay.
short acting,
Okay.
intermediate acting. They
Okay.
are I'm really confusing. So can you
Mm-hmm.
different types of regimen like that?
Okay. Okay. Not a problem. So, Ahmad, let me explain to you types of insulin first. Okay. There are
Okay.
various type like short acting, intermediate acting, and long acting insulins. These are termed according to the duration of their action and onset of their action. Is this clear to you?
Just long acting, short acting.
Short acting, intermediate acting, and long acting. So, short acting insulin has rapid onset of action and they have short duration of action. For example, short acting insulin will start their action in around 15 to 30 minutes. They will peak at around 2 to 4 hours and they have duration of action around 8 hours. Is this clear?
Oh yes, but you mean to say
Mhm.
start acting and the rapid? It is one and same thing.
Yes, yes. Short acting insulin is also called as rapid acting insulin. Okay.
And what about the regular?
See, regular
That
and
also comes in this domain.
short acting insulin has various categories like regular insulin and insulin analog. Regular insulin is like human soluble insulin, and another one is insulin analogs. So those are almost same, but like insulin analogs are prepared from the regular insulin by doing some genetic modification so that they have some little bit more advantages regarding the rapidity of action and their duration of action. Okay, are you following me?
But ultimately, they are not,
Ultimately,
the
their
regular insulin.
ultimately there is
Yes.
their action is same, their function is same.
Okay. Can you give me any example which this chart acting we use in the word? These are regular
Uh,
acting.
we usually prefer to use insulin analog like aspart and dispro.
Mm-hmm.
And so regular insulin like human insulin.
Mm-hmm.
Okay. So these long-acting and short-acting insulins are used in various combinations to produce different regimens. So have you
Okay.
come across any regimens?
So I don't have any this. I have heard, but I don't have the
Mhm.
exact regimen.
Okay,
If you
okay, okay.
clear my
Actually,
concept.
yeah, actually, these regimens are decided according to the patient's need, circumstances,
Mm.
and patient's dietary pattern and convenience. Means like
Okay.
it's like we have to tailor according to the patient's needs. We cannot have same regimen
Mm.
for every patient. We have to see into the patient
Mm.
convenience need and dietary pattern, and also like control of the diabetes also. We have to take into consideration all the factors. So according to this, we have three different types of regimen we usually used. uh, shall I go further, or you want to ask something here?
Yes. Can you tell me the
Okay.
names of
So
different regimen? This
first one,
combination of the short-acting.
yeah, first one I'd like to tell you, like there is basal bolus regimen. Second one is
Okay.
like twice daily regimen, and third one is like insulin pump regimen. Am I clear
Okay.
up till now?
Oh yes,
Okay.
I got
So
it. Mm.
what is basal bolus regimen is like we give a long acting insulin at the bedtime,
Mm.
which will cover the night time requirement of the insulin, and during the day we give bolus regular insulin or short acting insulin before the meals. Like if the child is taking 3 meals during the day, the short acting insulin is given just before the meal, like 15 to 20 minutes. So if you taking 3 meals in a day, then 3 injections during the day, short acting, and at night time we give long acting insulin. Is this clear?
Yes, but what is the beauty of the long acting? As you told, short acting that will cover
Yeah. Yeah.
the
Long,
6 minutes done.
long acting insulin usually have their peak of action at 4 hours, and they usually have action around 16 to 30 hours, depends on the brand. Okay.
okay.
So so what could be the advantage you can think in this basal bolus regimen?
Yes, basal bolus regimen that will prevent the also this during the fasting also it will take care of this sugar level when also body releases the glucose. So at that time this
Yes, yes,
long will take care of.
yes, yes, yes.
Hmm.
Actually, advantage of this basal bolus regime is more physiological. Like you can titrate the dosage according to the diet of the child. It has more flexibility regarding timing. If the child is taking meal at 2 o'clock, then he can just take just 15 minutes before the meal. So it has more flexibility. Also, like we can adjust the dose according to the child's carbohydrate intake of the diet. Are you
Hmm.
following me?
Oh yes, I got
Yes,
it.
but the
I'm
disadvantage is
getting
like child has to take more injection, like around 4 injections in a day,
right.
right?
Oh.
So can you tell me anything about like twice daily regimen? Do you think have any idea about this?
Uh, Twice a daily regimen I have heard like twice daily regimen.
Yeah.
Exactly know this
Okay.
combination. As you
Okay.
told this short acting and
Mm-hmm.
long acting, the
Mm-hmm.
combination.
Mm-hmm. Yes,
Given a twice, yes.
right. We usually use this twice a daily regimen. In
Mm.
pre-mix form, we have short-acting and long-acting insulin, and their timing
Mm.
of giving this injection is fixed, like in the morning and in the night. So
Mm.
what happens here, like there is less flexibility regarding the administration of the injection and diet. So
Mm.
child has to have fixed meal patterns. He has to take the meal at a particular time. Okay. And
And
if he misses a particular meal, then there is chances of hypoglycemia also, right?
mm. Yes.
Yes. But advantage is here that child takes only 2 injections in a day. Okay.
Mm. Yes.
So so like there is one advanced thing you must might have heard, like insulin pump.
Mm.
So in this, what happens in this insulin pump? The a small pump with a subcutaneous catheter is there with a syringe attached to it, and continuous baseline insulin is given throughout the day,
Mhm.
and
Time's up.
like there is continuous flow of insulin, like the pancreas secretes the insulin continuously according to the blood glucose, and child can activate the boluses when child is going to take meal. So it also gives more flexibility, and advantage is that child don't have to take injections regularly.
Mhm.
So what could be the
What are the
disadvantage you
disadvantages?
can think in this case of insulin pump?
Yes, the disadvantage we can think of, because it is a 24-hour, no?
Mm-hmm.
It will be there at the site.
Right, right. But another disadvantage is like it's very costly. Secondly,
Mhm.
there can be insulin pump failure. Sometimes the
Mhm.
battery may die, so the delivery of insulin may not occur. So child or parent has to be aware of this, and they have to do frequent blood check. Like they at least 4 to 5 times a day, they have to check the blood glucose. Are you following me?
Yes, but I have one query. This
Mm-hmm.
you took infusion, this insulin chamber or pump. Which type of this injection comprises of
Yeah, it contains
combination?
the regular insulin. Like it contains like regular insulin.
Only regular?
It does not have long-acting insulin. It has only
Mhm.
short-acting insulin. Are you?
Okay.
Is this okay? So, do you
Yes,
have any
okay.
other concern at this moment?
No, it is okay. Thank you.
Okay. So, can you repeat what we have just discussed today so that I will
Yes.
understand that you have got the correct information?
Yes. Today we have discussed the different type of the insulin regimen, including the short acting or the regular acting, intermediate acting, and also the long acting. And apart from that, in further also, in turn, it also contains the this basal regimen and two injection regimen, and also the insulin pump, and also their side effect. There also the pros and cons.
Mhm. Yes, yes,
Yes.
Ahmad. I must appreciate that you are very quick learner and a very good listener as well. So I'll suggest you, why don't you do a seminar on this topic so that your colleagues also will get benefit from this
Yes,
discussion.
sure. That's good idea. Thank you for your valuable suggestion. So I will make this PowerPoint and will also involve my friends,
Yes,
and
yes.
will
And
discuss.
I'll be very happy to help you if you have any questions. And I'll be attender to your seminar.
Okay. Thank you. Thank
Yes.
you, doctor,
And
for the
and
nice
I must thank
information.
you for refreshing my knowledge. Thank you very much for uh,
Thank
discussion,
you.
discussing with
Thank
me. Okay. Thank you.
you. Okay.
So time is
No, it was and as far the repo is concerned, it was okay, and also information part that also covered all the types, different regimen, and also their the uh, what we can say, the plus and minus both these aspects, and also the summary part discussion. So I think it is a, there is no any, what I can say, no any lacuna or filler. But just I was a bit still I am not clear regarding this the short
Short
acting,
acting.
rapid acting.
Yes,
It is what
that
they are
he
because,
created conflict.
and
One short acting. Let me
yes.
set the timer.
So
Once you're ready, tell me.
we'll just
Ready?
yes.
okay. So I'll read the scenario. You have to talk to a 15-year-old boy, Sandeep, whom you have first discussion regarding the transfer to the adult services. Okay, he has diabetes also.
Okay.
Okay.
Can we start?
Yes, yes.
Sandeep,
Hello.
good morning.
Good morning, doctor.
So I believe I am talking with Sandeep.
Yes, doctor, I am Sandeep.
Yes. How are you doing, Sandeep?
Yes, doctor, I am fine. My other problems are also in control. Diabetes also okay. But I am called here to discuss something. That's why I came here.
Okay. So, have you any idea regarding someone has told regarding the today's our discussion?
Yes, doctor,
Someone has.
I've been told like you people are transferring to the adult services. But doctor, I don't want to go there. Why you want to discuss with me the thing which I don't want to do?
Uh, you are very much right. So, what is your concern? Why you are a bit scary? Why you are not willing to this adult service? What we are planning to switch over to this adult health services?
See, doctor, I have diabetes, and since long time I'm following with you, and like I'm very much comfortable here. Doctor here are so nice. Nurses also know me. Like I'm very much comfortable coming to this clinic. So I want to continue here only. That's why I don't want to go to adult service.
Okay. So your concern is really justified, but just let me explain you because as far this since you have grown to this young adult since till this age, you're right, what we were looking after you were taking care of, but as far you're now is growing age in view of, so we are planning to this healthcare because they are more expert in the adult health service. So am I clear so far?
But okay, doctor, they are more expert. But you people also can manage. Till now, you people manage my diabetes very well, and I'm very happy coming here. And I like you, doctor. I don't want to leave you.
Yes, but we will, Sandeep will tell you, we will not abruptly transfer you to this adult health care. We will train you, we will explain, we will discuss with you all the aspects of the disease, their protocol, complications. And once you will be confident enough, then we will transfer to the adult health service.
But doctor, I don't want to go. That is the main thing. I know my disease. I know the complications. I don't want to go. That is the main thing, because I like coming here. You understand my concern, doctor.
I understand your worries and this scary situation. This is again, I you see it is at the outset. It is just like shifting from the primary to the secondary school like that. At the outset, no doubt, if I would be in a place, I also feel bit jittery because I have already been used here. I'm conversant with all the staff, but in the interest of your health, Sandeep, as I told, they are as far the protocol is concerned, and they are as since the pediatric age group, since the neonate child age group, they were competent enough in this. And now, as far your age is concerned, so they are expert in this. So that is why we are planning our whatever in the best interest of your health. Am I right? That what we are planning.
Yes, doctor. But see, you have my all information. They don't know anything about my illness. Then how they will treat me?
That is again your valid worry, but we will discuss, we will make the lesson with them, and we will involve you, your parents, and we will also discuss with the team. And it is the, it is transition, it is the gradual process, and we will apprise them, we will discuss with them, and whatever best in this will meet your requirements, whatever in the best of your health, then we will transfer, and the ones they will also be accommodated, and then we will shift. Am I clear, Sandeep?
Yes, doctor. Then like from tomorrow onwards, I will have to. I don't have to come here. How long it will take, doctor?
No, no, it is not like that. we will observe, we will wait and see, and it is not in a rapid process. I told it is a gradual process. It will involve different sittings with this adult health team, and also will involve you, and we will discuss, and it's slowly and gradually, until and unless you would be confident enough. So it is not an just a matter of one day or two, or as soon as possible. Once you will feel confident enough,
Okay, doctor. But
and then we will
hello, 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 hello. Can you hear me? Hello, 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 hello.